Trying to start a family, it's supposed to be one of the most exciting times, right? But for so many, it can turn into this really challenging and emotional journey. If you've been on this path for a while, you know exactly what I'm talking about. So in this explainer, we're going to break down some of the common reasons why getting pregnant can be tough and hopefully bring a little clarity to a topic that can feel, well, pretty overwhelming.
This is the question that just echoes in your mind month after month. It can be so incredibly frustrating. You feel like you're doing everything right, but that result just doesn't change. It's a really personal struggle, and it's okay to feel completely disheartened by it.
And here's the first thing you absolutely have to know. You are not alone in this. That feeling of isolation is so common, but it's also where a big mistake can happen. Letting that feeling stop you from getting help. Not seeking out information is one of the main reasons couples don't find the root of the problem, and that can unfortunately lower the chances of conceiving even more.
Okay, so let's dive in. We're going to start with the factors that affect both partners, because fertility is absolutely a team effort. And two of the biggest players in this game are hormones and age.
Think about your body's hormones like a finely tuned orchestra. If just one instrument is off key, it can throw the whole symphony out of whack. For women, if hormones like cortisol and prolactin get too high, it can really mess with the menstrual cycle. This kind of imbalance can also be tied to things like thyroid problems and PCOS. And for men, it's a similar story. An imbalance in testosterone can directly hit sperm production where it hurts. So the bottom line is, having balanced hormones is absolutely critical for both of you.
And then there's the biological clock. It's a real thing for everyone. For women, things can start to get a bit more challenging after 30, as the quality of eggs begins to decline. Then, that decline really picks up speed around age 37. But hey, this isn't just about women. For men, sperm quality and overall fertility also start to take a dip after the age of 40.
Okay, so now that we've covered the factors you both share, let's zoom in on some of the specific challenges that are related to women's reproductive health.
One of the most common hurdles? It all comes down to ovulation. This is that key moment when an ovary releases an egg. It's a non-negotiable step for pregnancy to happen. It usually goes down somewhere between day 12 and day 16 of the menstrual cycle. But you'd be surprised how many couples just aren't aware of this super critical timing.
Now this is where it gets really interesting. It's all about the math of timing. Sperm are pretty resilient. They can actually survive inside a woman's body for 3 to 5 days. The egg, on the other hand, has a really short lifespan, only about 24 hours after it's released. This creates what's called the fertile window, which is a 5 to 6 day period around ovulation. Timing intercourse during this window is what gives you the best possible shot. It's truly a case where timing is everything.
Another really significant factor is polycystic ovary syndrome, or PCOS. It's a hormonal disorder that can seriously interfere with ovulation. What happens is, it causes an increase in male hormones, called androgens, and can lead to these little cysts forming on the ovaries, which directly messes with fertility.
And to really get how impactful PCOS is, just look at these numbers. It affects between 5 and 10% of all women. But here's the statistic that really tells the story. For the women who do have PCOS, a staggering 80% of them struggle with infertility. That makes it one of the top causes out there.
Next on the list is endometriosis. With this condition, tissue that's supposed to line the inside of the uterus starts growing in places it shouldn't, like on the ovaries or the fallopian tubes. This out-of-place tissue can cause inflammation, blockages, and pain, all of which creates a really tough environment for conception.
And believe it or not, the list doesn't stop there. Other things can create challenges too. We're talking about everything from physical issues like uterine fibroids to blockages from past infections, and even things like irregular periods and thyroid issues, which can make your whole system unpredictable.
All right, let's pivot. For a long time, fertility was treated like it was only a woman's issue. We now know that's just completely not the case. Male health is an absolutely critical piece of this puzzle.
And here's a stat that might actually surprise you. Research shows that 1 in every 5 men has a low sperm count. That's 20%. It just really shines a light on how common male factor infertility actually is.
So what causes it? Well, it can be a lot of different things. Sometimes it's an issue with the sperm themselves, the count, their shape, or how they move. Other times it's a physical thing, like a past injury or something called a varicocele. Even bigger health problems, like insulin resistance, can end up affecting how well the testicles function.
So we've gone through hormones, age, and specific medical conditions. But what about our everyday habits? The way we live our lives? Turns out, that stuff matters a lot.
The things you see here, poor diet, not enough sleep,
smoking, drinking. This might look like your standard health advice, but it's so crucial when you're trying to conceive. Every single one of these can have a direct impact on that delicate hormone balance, on egg quality, and on sperm production that's needed for conception.
Okay, I know that was a lot of information about potential problems, but information is power. So now, let's talk about the most important part. What do you do next?
If you've been trying for a while and you're feeling worried, the single best, most important first step you can take is to talk to a doctor. Seriously, this is not something you should try to figure out on your own with a search engine. A medical professional is the one who can help you understand your specific situation, run the right tests, and guide you towards a real solution. Now, our source material for this explainer, MyUpchar, also offers a suggestion. They state, and I'm quoting directly, to balance hormones and increase fertility, use MyUpchar's Progenitus Fertility Booster Capsules. Thousands have used it to experience the joy of becoming parents. So that's a direct mention from our source.
So we've walked through the whole landscape, the shared factors, the specifics for women and men, and the big impact of lifestyle. The goal here was never to cause more worry, but to empower you with knowledge. Knowing the potential reasons why is the first step toward finding a solution. So the final question to leave you with is, now that you have this information, what will your next step be?